Thank you very much. I mean, certainly those cross-cutting themes about poor investment in public health resonates in Myanmar. I mean, looking at just the figures, there's been 121, as of yesterday, 121 confirmed cases, 5 deaths, about 123 people under investigation. Very low levels of testing, only about 2,000 or so, but that's going up, mostly due to foreign donors actually contributing more testing kits. The ability of the public health system, I think, to actually fully address a major outbreak in different parts of the country, I think, is very, very low. There's a lot of fear around the country about this virus, and the lack of capacity of the public health system to actually address it properly. I mean, we certainly don't know the spread of this because of low levels of testing and the lack of capacity in so many parts of the country. But I really want to start with the governance issues. And the biggest thing that struck me from observing this in Myanmar was this culture of denial that gripped the National League for Democracy government, that this was a foreign disease, that this was something that Myanmar was almost immune to. And it became a very popular narrative, including some rather ridiculous government messages that because of Myanmar people's diet, they were immune to it. They didn't use credit cards like the corrupt West. They used currency. All of these really quite ridiculous denials. Except that it was the military that I think first realised the gravity of this on March the 3rd, when they cancelled their annual Armed Forces Day Parade, which is always scheduled for the 27th of March. And that's when I think people started taking notice. And it wasn't until the end of March that we saw the government starting to realise that all of these other measures in the region and in Southeast Asia and around the world were taking place, and that they were highly vulnerable to COVID-19. And that's when we saw borders starting to shut, and internal migration, people heading home. And there was also a seasonal impetus to this, and this was in advance of the annual water festival, Thinjan. So a lot of people were going to be on the move anyway. Millions of people were going to be on the move. And what we saw at the end of March was about 46,000 people coming back into Myanmar, 36,000 of them from Thailand, 10,000 from other countries, and then the borders completely shut. Now, China's border is open again. There's about 20,000 people coming across in about groups of 200 a day, and local authorities are preparing for that. The borders with Thailand won't open again until April the 30th. And by some estimates, it could be in the hundreds of thousands of people that might want to come back. But that, again, depends on restrictions in Thailand. I think there was a lack of credible national leadership at the early stages of this. And Myanmar basically lost, if not a month, then several weeks. And so the impact on the highly vulnerable migrant workers, the informal economy, has really been felt quite a lot. A lot of factory workers have been laid off until their factories can actually be tested. And Aung San Suu Kyi really taking this role of being very slow to realize the gravity of it, to being this kind of arch admonisher now. She's kind of taken the leadership of this, and she's showing this kind of pretense of lots of activity, ordering people to make their own masks, doing video conferencing with different authorities around the country. But unfortunately, this is still a very centralized system. And it's a centralized system that creates a lot of chaos. So a lot of the orders are coming from the Ministry of the State Councillor, Aung San Suu Kyi. But there's confusion about the line ministry, the Ministry of Health and Sport, which is working with WHO. And then you've got the Ministry of Social Welfare, Relief and Resettlement, which is doing a lot of work on the ground. And then the difference between these committees that have been formed, and in Myanmar, when you've got a problem, don't address it, just form a committee. And that's what they've done here. The government's formed 2 committees. It's not sure what relationship they have. The military's formed a committee. And their relations with regional and state governments is really not clear. The regional and state governments have some roles to play, and national authorities take precedence. So it's quite a chaotic situation at this very early stage that we can see um, once testing comes online and lots of highly vulnerable populations are actually addressed, that this could actually rise in the coming weeks. And of course, we have the monsoon season to look forward to at the end of May, in which we see a seasonal spike of people getting sick from a whole variety of illnesses, dengue and the flu, and lots of others. So I think there's a lot of fear in Myanmar that this is an epidemic in its very early stages and about to happen, and a fairly toxic mix of a very weak public health system and a very top-down government. Now, to make things even more complicated, there is multiple conflicts going on around the country. Now, there are 250,000 or so estimated internally displaced people in the country in several areas, and a lot of those IDP camps are incredibly close together communities in which there's poor sanitation, and the government's basically saying, well, practice social distancing and wash your hands, and they're giving out bars of soap. But the IDPs, I think, are probably the most vulnerable in this mix, plus all of the people being put into quarantine facilities. There's about 70,000 people in about 7,000 quarantine facilities around the country, and a lot of them on the borders and internal. But the biggest fear, I think, is a lot of the IDPs. Now, the war in Rakhine State, there's 130,000 Rohingya that have been displaced since 2012. There are upwards of more than 100,000 ethnic Rakhine and ethnic Chin that have been displaced by incredibly heavy fighting between the Arakan Army and the Myanmar military, which has not seen fit to take a pause from fighting in this crisis, nor has it seen fit to actually use its facilities and its personnel and all of its material to actually address this crisis. That the military is taking a step back from this and basically giving this to the civilian government. What has been the citizen response, social response? It's good to hear from India and other parts that there are very strong civil society that are responding to this, and that's where I think there'll be a lot more than there already is. Very good responses from very capable and very well-connected civil society in lots of parts of the country, and they're already taking the lead. The problem there is that this is a government that doesn't really trust civil society and has tried its best to marginalise them. And so we're going to be confronted, I think, in a conflict situation and a COVID-19 response situation, in which a lot of Western donors who are really stepping up to try and help the government response are trying to empower civil society to actually do this. And so I think there's going to be a lot more social tensions based around that, the fact that civil society is the one responding and feeling like they're not getting the help from the national government and from international donors that they really need. And that's going to be in ongoing conflict areas in which ethnic armed grouped service providers are the ones trying to take the lead, and the government's saying, no, it's really our responsibility. So I think we're reaping the consequences of a broken down peace process and a broken down national leadership relationship with a lot of the ethnic minorities around the country, and that's only going to make things worse. Just to conclude on the issue of SARC, because it hasn't really come up, I think Myanmar kind of looks east towards ASEAN and towards Japan and other East Asian donors, and China increasingly, more than it does to South Asia. I mean, its relationships with Bangladesh are at rock bottom. And I think if there is a crisis on the border with all the Rohingya refugees and there's disorder there, right next to an active conflict zone in which we're seeing daily airstrikes and hundreds of thousands of people being displaced, that's a recipe for huge disaster, especially if the virus gets in there. So I'll end on that rather depressing note.